Hello, everyone. Welcome to another episode of Health Tech with Purpose podcast. And today we have a leader amongst us, Laura Merrick, who is a senior director and tech operations for the company Medical Home Network. So, Laura, hi, welcome. How are you doing?
Great. Thank you so much for having me today.
It's a pleasure because, like the work that you have been doing, we were really looking forward to have this conversation and especially about the impact that you guys are creating with interoperability and with making access to healthcare everywhere. So, why not we jump right away to know more about you, Laura? Would you like to give a quick introduction, especially, your background and what led you till here working with Medical Home Network and getting passionate about healthcare?
Absolutely, and thanks. This is always a fun answer to go through. I have a little bit of a non-traditional background in terms of how I got into healthcare and technology. I actually started in the arts as a professional dancer and trained very rigorously for many years and danced professionally. And part of committing to being passionate about something allows you to look at what is it that we really need to put in place to get the results that we want. And for me at the time, it was I need to figure out how can I continue to perform. And that meant I needed to raise money. I needed to go out there and understand how I could better connect with my community. And in that journey to connect with my community, I was led into the bricks and mortar of a hospital. And little did I know that when I left that bricks and mortar building of trying to figure out, how I was bringing dance, we were dancing in particular units in a hospital. Little did I know that that would have a lasting impact on my continued journey. I had no idea. I kept continuing to remember all of the sort of it just felt very, it was a very busy environment. I was able to connect with people and I wanted to know more. And so after that sort of experience where I had engaged with my community and reached into this hospital facility, really so that I could go continue to dance, I realized that I actually wanted to take that leap and go into healthcare. I wanted to know more. I couldn't stop thinking about it. And so I retired, changed my career, moved to Chicago, and for the last 20 years have been focusing my career on my community. And I've been very fortunate to do that at Medical Home Network. And just very quickly about that journey, Medical Home Network, if I could just sort of jump in, Medical Home Network is dedicated to transforming care in the safety net and building healthier communities. And being based in Chicago, what we've been able to do is really power the future of how healthcare can be delivered by creating this clinically integrated and digitally connected community, and bring in community-based systems of care that focus on that whole person. And that was really what mattered to me most. And I feel very fortunate to find Medical Home Network to be able to continue this journey of community.
Okay, so that's interesting. So, can you tell us more deeper into the Medical Home Network? So, what is life, for example, without Medical Home Network and the exact problem that you guys are solving here?
Absolutely. So we are a Medical Home Network is a nationally recognized non-for-profit collaborative, and we're, as I said, focusing on transforming care in the safety net and building out these healthier communities. We take an innovative approach so that we can continue to focus on delivering leading health outcomes, savings, and quality under value-based arrangements. one of the primary areas of our focus and expertise is partnering with federally qualified health centers and bringing them to the forefront so that they can participate in these models and really drive care across the continuum. When I first started at MHN, the problem, we had this a very, very distinct problem, and this was back before working specifically in Medicaid, before there was managed care organizations. We had no information really flowing. And in fact, in the state of Illinois, there was not a health information exchange at the time. So very little access to understanding what was happening outside of the bricks and mortar of your facility. So we started to drive care coordination, went around, this is back in 2009, went around to all these different CEOs and these hospital systems and FQHCs and said, hey, we really need to start collaborating. These are all of our same patients, and every single one of them checked their institutional identity at the door and said, yes, let's start partnering. These are our shared patients, and that was really powerful because it was the continuum and bringing the collaboration together to break down the silos and start to just share information and drive care coordination. We started really, really simple with I say simple now, but nothing is really simple. It was, we connected over 30 hospitals in Cook County via direct hospital ADT. That was not done in the state at the time, and we continued to grow that model. And ultimately formed a Medicaid ACO. And our journey to begin to improve how care was delivered across all these disparate systems. This is an important part because everybody's on a different different system. We're putting together, we're trying to drive a standard model of care and empower that through the technology across all the different institutions. And that sort of has been a great challenge. But also probably one of the most rewarding things that we've been able to do. And, I think in the journey, Medical Home Network is now leveraging our deep experience with the Medicaid population to improve care for Medicare beneficiaries through an ACO REACH model. So we partner, as I said, with federally qualified health centers to organize them for success under value-based care and create that community-based systems of care around this proven model that we have. So I think it's really about, at the end, I've talked about ADT and sort of bringing the community together, but if I could summarize it, we're really trying to, from a technology and data standpoint, bring together the right data at the right time. It's really right data, right time, right place, and sort of driving that home for everybody. So regardless of where they are in their technology journey.
Yeah, of course, the irony in healthcare is we all see that, like easier said than done. So it's always like, okay, we're just trying to do this, but then it just is a complex mess of a lot of dependencies and integrations and interoperations and so on. Yeah. So tell us more. Yeah. Go ahead, please.
Well, I was going to say, I love how you framed the question to me, like, what is the problem? And I think that that's what we always have to continue to focus on is let's begin with the problem. If we're beginning with the problem, we can really start to guide where we can go and how we drive change. So I really appreciated how you asked that.
Yes, right. So, since, like you said, you started, Laura, like 10 years back, systems very different then. I believe, through these years, people have realized, how much it is important to integrate, to interoperate, and so on. So tell us more about the key challenges, that you see today in bringing these technology innovations to healthcare providers. And then, especially as a senior director in technology, like what you guys have been doing to overcome these challenges.
Yeah, so I think one of the things too that I'd love to highlight about what Medical Home Network is doing in you know we have had to really focus on a proven model of care, right? So we focused on how can we link care coordination to primary care and push that at the practice level, and that's really been our model. What that means is we're not driving central care coordination. We're really ensuring that the care is delivered by the providers within the primary care practice setting. We focus on care teams that are hired for the community, and they for the community and within the community to build the trust with the patients while coordinating the care across sort of all venues and settings. And the reason why I'm talking not about the technology is because it is then the technology that can empower and connect providers and enhance that communication across the health system in service of the patient when we're very clear on um, what is it that we're solving. We're really trying to organize and empower a model. And so I think along the way, that meant we needed to understand and eliminate the barriers and break down those silos. And so it really had to start with the people, and ensuring that we knew who needed this technology. Why did they need the technology? What was the technology? And so we focus on whole person care, which means we really needed to think not only about the medical, but the psychosocial. And we did that through, in breaking down the barriers, organizing a standard screening that it did address the social determinants of health and identified the rising risk of the population. And the technology that we were then able to implement to sort of be ahead of that and understand the community, we leverage AI, we incorporated SDOH to really identify risk, but not just identifying risk, it's really the rising risks in the patient. So we were very focused on helping providers devote resources in a productive way so that the patients that needed the support the most were going to get it. And overall, what we've seen, if we're focusing the providers, giving them the tools, then we're really actually seeing the results of lower cost and better health outcomes. That's really what we wanted to do. Through technology, I think this wasn't for us about let's go build this piece of technology because it's sort of the buzz and it's really, we know it's going to help. We really focused on why and organizing ourselves to drive the technology and the data to be powered, to put to real use, to make real change and impact the population. That makes sense?
So, so Laura, you mentioned about the community angle, and so please elaborate more about what is really a community, and how is it different when you say building the solutions, integrating communities, when you could have said individuals or organizations. So, what's this community angle all about, and how does this helps?
Yeah, I think it comes with our foundation of whole person. We needed to understand the people in the community, and that's what mattered most to us. So we wanted to look beyond just the medical facilities that we know about where care is delivered, the FQHCs, which is very important to our model, the hospitals in which the patients seek care at. We really wanted to go a little bit further and understand the neighborhood. That meant we needed to think about what resources, what is that experience like for the patient or the member of the community. It was about the people. What is in their community? What resources do they have access to or not? What community-based organizations will matter for us to sync and connect with? And connecting and communicating and collaborating was fundamental to the success of driving change. And one of the things I want to talk about around that community, and it ties back to parts of our conversation earlier. What is the problem we're solving? Well, we realized that a lot of activity is happening in all these different places, and providers do not always have access to complete information or usable data on their patients at the point of care. And, not surprisingly in healthcare, siloed data and disjointed data remains an issue. And so to address that problem and really invest more in our community of patients and providers, we started to reimagine what that experience needed to look like. So we knew that the primary care physicians really did not want to see all of the data. It was overwhelming. They only wanted to see the top important pieces of information. And we, much like you would see on a baseball card of your favorite player. And providers also, didn't want to dig and siphon through various records in different places to figure out what was happening on the patient. So we created a baseball card for the patient. And we took the time to, and that's what we did. And that's why it was sort of like, how do we get this information available? But we wanted to think about the provider as well. So we organized the disparate sources of data that are not otherwise in the EMR, what's happening in the community, what activity is outside of their facilities. And we put them into a brief summary that was actionable for the primary care provider at the time of the patient interaction. And so the data elements that I'm talking about was absolutely the real-time hospital utilization, the artificial intelligence risk score, stratification, medication adherence. We really added analytics and intelligence to the information so that they could see, are the patients, what are they, not only are they prescribed this, but what are they actually taking? What is the percent days covered? And then we pull in medical and behavioral claims or any activity or communication happening from the community organizations. And then we actually integrate that into the electronic medical records. And the reason for doing that and pushing that into the EMR is, again, where I started the conversation, the end result for us was about right data, right time, right place. And in the moment, at the point of care with the patient, that's in the EMR for the provider. So that was, that's kind of how we tried to embrace and pull pieces of information and technology together to think about our community as a whole.
Right. In fact, good that you touched upon the baseball card concept. So I really wanted to talk more about it because I saw that is one of the recent big initiatives from you guys. So tell us more about what's the background behind launching it, and what has been the initial reaction with the end users and how it has been helping with the whole mission.
Yeah, I mean, it really started with that simple problem of, again, I said simple, but it's healthcare. What I really meant is that, the complexity is, there's not a lot of access to information. And when we started to really understand how much was happening and all the coordination that was occurring, we really looked outside to think, what is the best way that we can bring this information in? A little bit about how that needed to appear. The baseball card data needed to be dynamic. So for this to be a part within the provider's workflow, we needed to lead that workflow. And it was important that this information was in the workflow so that we could understand how the patient was interacting with the rest of the health system. In order to do that in an effective way in terms of implementing, one of the things I will just say is that we are a clinically integrated network of providers, which means every provider system, FQHC, is on a different health record, a different electronic medical record. Mm-hmm. And a lot of them, with these various types, we had to look at what are their technical capabilities. They do not all have the same, but we really wanted to continue to deliver something that worked for them. So we had to look at the entire solution and think about what was the easiest path forward to implement it. It's always that last part, whether they had technical resources or not. We really needed to make sure that we were clear in mapping this information within the appropriate workflow in the EMR in a place that was trusted by the provider.
Okay, cool. So every user in the system today has a baseball card, or has it been released like in phases? Like what's the status today? Because we launched, yeah.
Yeah, absolutely. So we run several different national programs we started our journey in Medicaid in Cook County. That was where we really started to drive impact around a population. We have journeyed out, I said, into different nationals, different states with our Medicare strategy, and have continued to make this as an offering for all patients within our REACH or Medicaid ACO. So this is something that we bring forward. What takes time is organizing and getting access to the information. And once that's in place, we then first offer the visibility of that information within our care management application, which we call MHN Connect. And that is the tool that is it is a NCQA certified tool that works outside of the EMR to organize the population to drive the various care management activities. And so we push that first available to the care teams that are coordinating the care. But those individuals accessing the baseball card in the application are not necessarily the primary care provider. So once we sort of create the pathway for the care coordinators or care managers, which sometimes could be licensed or unlicensed individuals, we then start to partner with them to understand what could be that pathway forward to better connect and communicate with their own primary care physicians for the patient. And then we begin the pathway to assess what sort of mechanism or API push we can leverage. We do look at leveraging what is existing and available so that it can be reachable for all providers. So we're pushing that data in according to what is accessible or allowable by that particular EMR.
Okay, cool. So like baseball card, for example, has been one innovation, and I really like the fact, like you pointed out, like you sit on the problem and then you guys, at MHN, you have a process that how you basically, what are the possible solutions, and then try to figure out the simplest of the solutions that are really effective. So my question, next question is to know somewhat more about the innovations that are happening at MHN. Would you like to talk about things that you guys are looking forward to release in 2023 and beyond, and the technology play there? Yeah.
Absolutely. I think we have been pioneering in leveraging AI and incorporating SDOH so that we're ultimately continuing to continue to drive the results through opportunities with data. And so I think there's always more that we are focused on doing with that. I also think we often, as data is coming in, drive specific points in time of information. And one of the things that we are doing is sort of pushing the boundaries and really looking at all of the pieces to contribute to the model so that we are capturing some of the unstructured things in the process too, right? That's really where we start to see what's really happening, what are those notes, but we're looking at it in a way that allows us to really advance the AI and really focus on what areas of the population, what disease states need additional assistance or need help. So I think ultimately where our innovation, is going is really continuing to leverage our existing expertise and bringing this more nationally to other different types of programs around ACO REACH and Medicare. So I think we're going a lot deeper with the work we've been doing that we really see these proven results from around care coordination and primary care.
So, Laura, as we are in the podcast Health Tech with Purpose, so tell us more about your purpose individually, personally, like what you look up to when you wake up every day, or what keeps you awake at night and keeps you moving.
Yeah, I mean, I think I think for everyone, I think ensuring a strong foundation is critical. We often want to jump to start to use the different, use FHIR, use all of these different standards because we want to learn and we want to bring it forward. But I think what will allow us to really adopt to the ONC standards that are coming on are really, something that, we're really passionate about is being able um, to really focus on data governance to solve some of the data sharing issues that we see, particularly around the primary care FQHCs and the community, so that we can address freely sharing social determinants of health, particularly when we see provider plans are unable to share that information because they're bound to limitations like minimum necessary and an organizational policies and procedures. And so we really try to focus on, while we're delivering the technology, that we're really thoughtful about how can we continue to eliminate the barriers around sharing data, around being able to adopt the standards. And I think what that comes from is remembering the strong foundation, and it's sort of a little bit, medical home network. We're really constantly sort of building these houses and neighborhoods and engaging, is just as a parallel here, and that the way that we're able to leverage our deep expertise and move nationally in this model is because we're focusing on our foundation. We're thinking along the way. It's not just about the technology. It's about the governance. It's about the process, the people, the value-based care. What does it really take? And I think systematically, the building block for system transformation, it's not one thing, but it's how in the aggregate we weave these pieces together to drive change and success.
Nice,
So
nice.
let's ensure a strong foundation for the patient.
Right, right. In fact, a lot of one thing I could not, avoid noticing is that, right when you started your career, it has always been with MHN. So, and in today's world, many times we see, people jumping ships, for growth, for prosperity, for purpose as well. So, as a senior executive, how MHN has helped you fulfill your goals, and what has helped with this longevity and consistency.
Well, I think the thing is that, so I started my journey, as you stated, right around when the organization was founded. And when you commit to something so big as improving care delivery, it takes time. And, solving
Patience.
problems that affect people take time. Medical Home Network has given me that time, because I'm able to continue to see the results. So if I'm working on a particular component of technology, or thinking about easy access to data, or really how are we thinking about how interoperability can benefit the patients and the providers, these things take time, and I've been able to see the results firsthand through the impacts that MHN has made across the industry. And so that's sort of, that foundation. I am here because we are pioneers and we are innovators, and we've been doing that since 2009, and that's why I've continued to stay. So I think the other thing that in that work is we've really expanded our mission, and the impact to be able to do this great work. moving from my roots in Chicago to impact nationwide to Medicare using that same MHN model and approach, powered by technology, is really incredible to be able to bring this to new communities. Because I'm really committed to healthier communities, and that's something that MHN has given me.
Great. Great talking to you, Laura, today. And thank you so much for opening your heart and sharing with us, all the insights and helping all our viewers learn a lot more, a bit more about healthcare from whatever they were doing. Thank you so much. Have a good one.
Absolutely. Thank you for the opportunity.